Dual enrollment has been a reality and a success in several fields of study in South Texas, where high school kids can also get an associate's degree. As they graduate from high school, they're walking away with a little bit of a sheepskin. They get an associate's degree from college and some college credit. But yesterday, what was referred to as, and I agree with this term, a game changer. An opportunity for kids to graduate high school, some kids in South Texas, to graduate from high school and have an associate's degree in nursing and be on a track that they will be set career-wise, money-wise, and to benefit the entire community, because, man, we need nurses. This new pilot program was announced yesterday. It's a partnership with several institutions. Among the institutions joining us from FAR San Juan Alamo School District, the superintendent is Daniel King. Dr. King, welcome back to the show. Happy New Year. Good to talk to you again, friend. Okay, so explain to me how this program is going to work with high school students, and which high school students are you referring to over at PSJA?
The first group or cohort of students entering the program are current high school sophomores, and they're being selected from all of our high schools. So we're selecting an initial group of 60 students from all of the PSJA high schools to enter the program. And ultimately, over the next 2 years, that group will be weaned down to a group of about 24 that would potentially complete their RN licensure and their associate degree of nursing by the time they graduate from high school. And then the remainder would be able to pursue some of that after high school.
That is amazing. Okay, now these kids, are they going to be meeting at a specific campus? Are you building a facility for them to study all of these complex issues? Is this requiring something new for you to build?
Part of it is we're in the process of converting one of our older campuses that we're moving out of into sort of a magnet academy setup for half-day programs for different areas, the health occupations fields, engineering, and different areas like that, so that we can accelerate our students studying and getting their associate degrees in these areas. So part of it will take place.
Okay. This is a first-in-the-nation project, right, Dr. King?
It's certainly the first that I'm aware of.
Yeah.
It would certainly be very rare.
To give high school kids an opportunity to graduate with an associate's degree, college degree in nursing, and then move on to bigger things. And as Dr. Shirley Reed from South Texas College, who was one of the speakers yesterday, said it best, told, because there were several kids in the audience, I'm guessing some of the candidates, telling him, you need to be straight-A students, you need to sacrifice your social life, but man, you are set. If you continue on this path, you are set. Also joining us on 710 KURV from Doctors Hospital at Renaissance, one of the partners participating in this pilot project. I do believe that some of these kids are going to be working the halls and shadowing some of the professionals there. Israel Rocha is the CEO from DHR. Israel, welcome to the show. Whose idea was this?
It started sort of as an idea collectively in our group. We were sitting down and seeing what we're going to do about the nursing shortage. And we actually posed a question to the nursing leadership team, and we said, what can you do to help us make sure that we get a pipeline of kids going forward? And it really did make a sense to work with a school district to get them ready. However, I had challenged them to do a nursing certificate, and they came back with this wonderful idea after having worked with PSJ of getting them to have a full registered nursing license and an associate's degree graduating college. We were very excited by the opportunity, and from that idea and that discussion and working with Dr. King and his staff, they came forward and had yesterday's historic announcement. We're all very excited.
We're talking about a pilot project that is going to allow some high school students, specifically PSJA, to work with several institutions, including DHR, to get an associate's degree, a college degree in nursing as they graduate from high school. Joining us on 710 KURV, Superintendent for PSJA is Dr. Dan King, and the CEO for DHR is Israel Rocha.
Israel, Tim Sullivan here. I'm having kind of a hard time believing that this is the first in the nation dual enrollment program in nursing. I mean, I can't believe that it hasn't happened not only here, but anywhere else. What did it take to get this idea on the table and now to bring it to reality?
They have looked everywhere around the country and have not found one yet. It took a lot of our nursing leadership staff. They went and they met with the president of the associations and the heads of the nursing boards. They've had a visit with community colleges and with high schools. They had to compare curriculums. They had to put it all together, and they had to actually do a very careful process to see how they were going to be able to fit it all in and what they could do. And so it was over the course of a year that they were planning and methodically looking through the curriculum, looking how they were going to be able to get the classes in. And at the end of the day, they were able to successfully put together a curriculum that students are going to start this spring on trying to get their qualifying classes in Anatomy and Physiology 1 to start the track, as Dr. King said, for 24 students. So it took a lot of effort from a lot of people all over the country to create the curriculum. So we're very excited. It's the first of its kind that has been put together.
Yeah. What do you see, let's say, 4 years down the line when this program ramps up, the nurses get their experience and they graduate, and now that we have a 4-year full-fledged medical school in the Valley, what do you see down the line, I guess, in terms of relieving the nursing shortage?
Yeah, I think you start to see a real dent where the Valley can have its own students help fulfill the needs that we need here in our community and serve as a national model for around the country on how we can help address the nursing shortage. I know that we will be successful, and it will help be a pilot that other people can reproduce in their communities to make sure that we take care of the nursing shortage here with students who want the opportunity.
Quite an incentive to keep a lot of medical technicians, nurses, doctors, whatnot, all right here in the Rio Grande Valley.
Dr. King, do you see this as a pipeline for the UT medical program as well?
It can definitely help with that, and it can also help with the nursing shortage in a different way. Many of these students will go on after graduation for their bachelor's and master's and advanced degrees. And, one of the areas with the nursing shortage is a lack of nurses with master's degrees and PhDs to teach in the programs.
Good point.
So many of these students will also get a head start towards getting their advanced degree by starting so young.
And, of course, Israel and Dr. King, the objective here is keep the grades up, because you're still going to be looking for the best of the best, the cream of the crop. The best ones are the ones who are going to be able to advance into higher learning when it comes to medicine. Gentlemen, thank you so much. Boy, we could just keep talking about this fascinating program over at PSJA, DHR, and STC, and other institutions that are participating in this. From what we understand, first in the nation pilot program, allowing high school kids to get a college degree in nursing, and also start working the halls over at DHR, shadowing some professionals. Thank you, gentlemen, for joining us. Dr. Dan King from PSJA Superintendent, and Israel Rocha, he's the CEO of Doctors Hospital at Renaissance.